Adopting a balanced diet rich in fruits, vegetables, and whole grains, while limiting salt and processed foods, can make a significant difference. The average American diet is often too high in sodium, which can strain the kidneys. Avoiding excessive use of over-the-counter pain medications like ibuprofen and naproxen is important, as these can damage the kidneys when used frequently. Staying well hydrated is also essential. Most Americans should aim for about 8 glasses of water a day, though individual needs may vary. Be aware of early warning signs of kidney problems, such as swelling in the ankles or feet, changes in urination, persistent fatigue, and high blood pressure. These symptoms can develop slowly, so regular health screenings are vital for early detection. By understanding kidney function and taking preventive steps, Americans can significantly reduce their risk of kidney disease and improve their overall health.